How do benign and malignant colon polyps differ? Imagine finding a small bump inside your colon during a routine checkup. Not all bumps are the same, and understanding the difference between benign and malignant polyps can be life-changing. Benign colon polyps are non-cancerous growths that develop on the lining of the colon or rectum. They are usually harmless and do not invade surrounding tissues. These growths are often found during colonoscopies and rarely cause symptoms. Some benign polyps, like hyperplastic or inflammatory polyps, are very common and tend to stay harmless over time. Others, such as hamartomatous polyps, are rare but generally benign, though they may be linked to certain genetic syndromes. On the other hand, malignant colon polyps are a different story. These contain cancer cells that have started to invade beyond the surface layer of the colon lining. Specifically, they invade into the submucosa, which is the layer beneath the mucosal lining. These are considered early-stage colorectal cancers and are classified as PT1 tumors. The concern with malignant polyps is their potential to spread to nearby lymph nodes or other parts of the body, especially if the invasion is deep or if cancer cells have entered blood vessels or lymphatic channels. Looking at their types and histology helps clarify the difference. Benign polyps include hyperplastic polyps, which are small and usually harmless, and inflammatory polyps, often related to inflammation or conditions like inflammatory bowel disease. There are also hamartomatous polyps, which are rare and usually benign but can be associated with genetic syndromes. Precancerous polyps, which have the potential to turn into cancer, include adenomatous polyps or adenomas. These make up about 70 to 80% of colon polyps and are considered the most important to monitor because they can develop into cancer over many years if left untreated. Adenomas come in different types, like tubular, villous, or tubulovillous, with villous types having a higher risk of becoming malignant. Serrated polyps, including sessile serrated adenomas, are less common but also carry a risk of turning into cancer. The way these polyps look can also give clues. Benign polyps can be on a stalk, called pedunculated, or flat against the colon wall, called sessile. Flat or sessile polyps are harder to spot during screening and are more likely to be neoplastic or precancerous. When a polyp is removed, it is examined under a microscope to see if cancer cells have invaded deeper layers. Malignant polyps often show invasion into the muscularis mucosae and into the submucosa, which helps determine their potential to spread. Most benign polyps do not cause symptoms and are found during routine screening colonoscopies. Malignant polyps, however, are early signs of colorectal cancer, and their detection is crucial. If a polyp is found to be malignant, further treatment might be needed, such as additional surgery or more frequent surveillance, especially if there is a risk of spread. Removing polyps during colonoscopy is a key way to prevent colorectal cancer. Removing benign and precancerous polyps significantly lowers the risk of developing cancer later. When a polyp is found to be malignant, doctors may recommend further treatment beyond just removing it, depending on how deeply the cancer has invaded and whether there are signs of spread. In summary, benign colon polyps are growths that are not cancerous and usually do not pose an immediate threat. Malignant polyps contain cancer cells that have started to invade tissues and have the potential to spread. Recognizing these differences highlights the importance of regular screening and timely removal of suspicious polyps to protect your colon health. Always consult with healthcare professionals for personalized advice and appropriate management.